There is now a second case of lab-confirmed measles in Nova Scotia.
At this point, there's no evidence of any increased risk for the general population. The appropriate steps are being taken, and the families involved have, did reasonable steps to isolate people as soon as they became ill.
Nova Scotia's Chief Medical Officer of Health says the case is a child in the northern zone.
There's 3 other people that we're following up linked to that. So we fully expect that we have increased measles activity in certain communities.
The new case is related to travel but is not connected to the other confirmed case of the virus. Strang says measles shouldn't be taken lightly. The effects on children can be especially serious.
They can get high fevers, they can get ear infections, it's not uncommon to get pneumonia. There's certainly a risk of going on to get inflammation of the brain or encephalitis.
That makes low vaccination rates all the more puzzling. In Nova Scotia, almost 1/4 of children were not fully vaccinated for measles in 2024. In New Brunswick, that number sits at 10%. Same on PEI. Health officials on Prince Edward Island say there are no cases in the province. This comes after a couple cases in June, as well as more than a dozen potential exposures. With measles cases increasing worldwide, there is a push in Nova Scotia to increase vaccination rates.
In the last few months, we've immunized 5,000 to 6,000 Nova Scotians. Many of them are kind of younger, middle-aged adults.
A good start, but Dr. Robert Strang is still anticipating more cases of measles across the province. And Todd, there are a couple reasons for the low vaccination numbers. One is the lack of access to a family doctor. There's also a lot of mis and disinformation out there, Todd, about the measles vaccine that was first introduced in Canada back in the 1970s.
All right, John McGinnis leading us off from Halifax Common tonight. Thank you, John.